Hello everyone, I'm Dr. Raghu Athre, a double board certified facial plastic surgeon here in Houston, Texas. I see a lot of consults on a daily basis for people coming in for facial rejuvenation surgery. And a question that I get over and over and over again is what actually happens in a facelift? What actually goes on? Everybody sees the before, the after, but what actually happens in between in the black box that's the operating room? So I decided that I'm going to go ahead and make a video about this so that A, it helps my patients, but also may help anybody out there who is considering a facelift or facial rejuvenation surgery to find out what actually happens behind the curtains, okay? Revealing everything. So if you are undergoing a facelift surgery, by definition, basically you're trying to lift cheeks, jaw, neck. That's kind of what the game plan is. So there's probably some degree of ptosis, which is the fancy word for droopiness. Sounds so much better than droopiness. So ptosis of the midface, jawline, and neck. And we're trying to resuspend or lift up those tissues in a facelift. Now, I'm going to basically, as I talk about this, talk about it from my perspective. What I mean by that is every surgeon out there has a little few tweaks that they do differently and the process and the technique and all this kind of jazz. So I'm going to give you the synopsis, but from my perspective and how I do it about 99% of the time. There's always going to be a little bit of a deviation, but this should give at least enough information that you kind of understand that the doors are open and you can see kind of what's going on. All right, so the entire surgical process, in my opinion, really begins with the preoperative appointment. So in the consultation, we've kind of looked at you, we've thought about it, you've told me what you want, I've done a quick physical examination and given you my recommendations. From there, there's a lot of administrative stuff in terms of scheduling and financials and all that kind of jazz. And then you get to the point where the preoperative appointment is where I get to meet you and we are reconfirming, okay? So this is the point where I sit down with you and go, okay, I discussed with you doing a facelift. This is what we're going to do, A, B, C, D. Is that correct? And you go, yeah, that's correct. So at this point, Elia is going to go through the process with you, tell you what to do, what not to do, when to eat, when not to eat, all of that jazz. I come in at that point and I'm going to do a surgical consent form on you. What is a surgical consent form? The surgical consent form is a group of forms which are actual permission slips that allow us to do surgery. That's basically, it's a little mechanism of communication between you and me that I've told you, hey, listen, this is what we're going to do. This is how we're going to do it. These are the things that could go wrong. This is how we fix them. Are you cool with me doing surgery? Okay, that's the basic rundown of a surgical consent form. So once we've done the surgical consent form, that's really me kind of reconfirming with you after consultation that our game plans are all simpatico. We're good. We're good. This is what we're doing. Once that's done, the next time I'm really going to see you is on the morning of surgery. So on the morning of surgery, the patient normally comes in, or you're going to come into the office, and there's a little bit of admin stuff that happens. Elia escorts you back to the preoperative room, helps you get changed into the surgical garb, and then I come back in, and this is my final checkpoint with you with respect to what we're doing. So what I normally do is the night before surgery, I sit down with your photos, I look at your chart, figure out what we're doing, what the plan of action for the day is, how we're going to do it. And then, so the morning of surgery, I come in there and I first chat with you and go, hey, we're doing a facelift. I've already looked at your consent forms. That looks good. I've looked at your history and physical. That looks good. So that is me going in my mental checklist and going check, 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 making sure T's are crossed, I's are dotted. Once that point is done, then anesthesia is the next step. Now this is kind of a little different for every case. Most of my facelifts and facial rejuvenation cases are done under oral sedation and local anesthesia. However, probably most surgeons out there use general anesthesia. I sometimes do use general anesthesia. So either way, whether it's oral sedation or general anesthesia, that's the box where anesthesia comes in. What anesthesia is doing is basically giving you medications to bring anxiety down, nervousness down, and pain down. While that's going on, I'm going into the operating room, double checking that I have everything that I need. We have a big white marker board, and I put my game plan out there so everybody on the surgical team knows what we're doing, the order of what we're doing, and how we're going to do it, so that there's communication, communication, communication. So one of the recurring themes that you can see probably in a lot of my videos is that planning leads to perfection. So I like to pre-plan, make sure everything is cool, easy, because I don't like surprises. I don't like having to just make it up as I go along. Sometimes that happens, but the more you plan, the more you can kind of predict how things are going to go, and that increases your ability to perform at a very high level. It's like a football team. All right. So once all that's done and the anesthesia portion is done, whether it's general anesthesia or I've given you oral sedation medications, the patient is then subsequently brought into the operating room. The first thing that's done in the operating room is the entire face is prepped and draped, meaning they take special solutions to clean all the face to make sure there's no bacteria and all of that. Now, most of the time in the preoperative room, when I'm talking to the patient and confirming things, I will make some markings. So sometimes there are very specific markings that I make. So as they're prepping the patient, some of those markings are going to be either lightened or removed. So after prepping, first thing that we do again is remark everything. And I get to mark everything. The marking itself is me double checking, triple checking, quadruple checking all of my thoughts. Little simple things, right? So for example, on a facelift, most of the time I use an incision that is in the temporal tuft or the little sideburn tuft. I like that incision. However, if a person has a very low sideburn, I'm going to use an incision up here because it just is much more camouflaged. So all of these little things are being seen in consultation, rechecked at the pre-op appointment, rechecked on the morning of surgery, and then the marking that I do in the operating room is that kind of that final gut check and me going through my process in my head. Once that's done, I will actually numb up the entire face. So this brings up a very good question, right? So most patients are going to go, well, why do you need to do that, doc? Because if I did general anesthesia, the anesthesiologist has done the anesthesia, or if you're doing oral sedation, you're telling me you're giving me these sedation medications. So the medicines that you get either in general anesthesia or in oral sedation are systemic medications. What does that mean? They go through the entire body. What they're doing is they're reducing anxiety, nervousness, and pain. Okay? Now, your face has a lot of nerves in it. This is why if you pinch yourself or thing, it hurts. And number two, has a lot of blood vessels. So, for example, if I'm shaving and I nick myself, it bleeds because there's a lot of blood vessels. So what I do is I numb up the face with a very specific solution. It's a solution that I have basically mastered over years and years and years. Now that solution has two components, two basic components. One medicine is to give anesthesia, meaning to numb up the face so that you feel nothing after I inject it. The second component of that medication is a medicine that actually makes blood vessels shrink up. The result of that is less bleeding and less swelling post-operatively. So when I inject the entire face, what happens is that from this point to this point, or wherever I'm injecting, you're getting complete anesthesia. You can't feel anything, and the blood supply is drastically reduced. That allows me to do my work with a lot more ease. So once I've numbed up the face, if you are getting general anesthesia, the anesthesiologist doesn't have to give you a lot of medications to keep you comfortable. Similarly, if I'm doing local sedation in my office, local with oral sedation, I don't have to continue giving you systemic medications because if you feel nothing, you're very comfortable. The lack of me having to give you a lot of medications through your entire body, this is why my patients are able to recover sooner, because those systemic medications kind of linger in your body for a while. You've got to excrete them. Your body metabolizes it and you get rid of it, but that whole process takes a while. So therefore, patients feel icky for longer. The more you can target the area where you're working, the less systemic medications that are needing to be given, and therefore patients recover a lot more quickly. So that's the real reason why I inject all that. So once I've injected the whole face, I basically wait for about 25 minutes or so. Why I do that is as follows. So there were two components to the medication. The first one was the sensation, the touch, the nerve blocking agents. That medication probably works in about 1 to 2 seconds. So once I inject it, within a few seconds, it's numb. The secondary medication that makes the blood vessels shrink up takes about 20 minutes to work. So if I start working before that point, I'm not seeing the full effect of that medication. I'm going to have a little bit more oozing. I'm going to work a little harder. By waiting that 20 minutes, having a little patience, my field that I'm operating in is completely bloodless, and it allows me to work faster, more efficiently, and I have a whole lot more visualization. So once I've numbed everything up, 25 minutes, wait, now we get started. So on a facelift, I kind of start here. This is my starting point. So I make my incision in the neck, which is under the chin. And the first thing I'm going to do is dissect the skin from the underlying muscle. So the skin in this area is lifted. Once I do that, I find the platysma muscle, dissect that, and get underneath the platysma muscle. If there's some fat in that region, I may address the fat at that point, but that's about it. Stop. Then I go to the right side. I'm going to make my incisions and lift the skin from about here to here. Stop. Do the same on the left-hand side where I make my incisions, lift the skin from here to here. Stop. So recap where we are. Skin is lifted from here to here. In this area, skin is lifted, platysma is dissected, and we've created our plane under the platysma. Once I've finished that, I jump back to the neck and I start doing my deep neck work. This is where I really kind of shape the neck by taking out some excess fat from underneath the platysma. If there's gland removal that's necessary, this is the point where that's done. Once the deep neck work has been done, I stop and go back to the right-hand side. I'll make my incision in the muscle layer or the SMAS layer, dissect the SMAS layer underneath the SMAS layer, so deep plane, high SMAS, doing the techniques in order to get underneath the muscle layer to the appropriate distance. Then I will go ahead and lift the SMAS layer back, trim the excess muscle, and sew all that. So what that's essentially done is lifted mid-face, jawline, neck on one side. Lateral neck, not the whole neck, but just the lateral neck. Same thing on the left-hand side. Make my incision in the SMAS, dive underneath the SMAS, dissect, deep plane, high SMAS, go all the way, lift it in the appropriate vector, trim it, sew it. So now we've got mid-face, jawline, and lateral neck done. Then I come back to the neck, and then I've got to do the neck muscle platysma work, which is the corset platysmoplasty in the midline. So I've already lifted all of this from the side. I have already done my deep neck work. Now is where I figure out how much of the bands I need to cut, put my platysma together, sew my platysma. Okay? When I'm doing my lateral incisions, that's where I put the drains as well. So once I've done the neck, I will close this incision, and then I go close this incision, put my drain, close this incision, put my drain, and then we're done. At this point, Elia is going to clean the entire face. We'll put on the dressings, and then the patient is sent to recovery, and from there they're discharged home. So that's kind of a brief synopsis of what happens inside the black box that's the operating room. So I hope this gives viewers a kind of a little bit of an idea of what goes on in there, so it's not as much of a black box and not as scary. Also, so most of my patients who undergo the sedation and the oral sedation with local anesthesia have no recollection of any of this. So when I ask them the day afterwards, hey, what do you remember by the operating room? They have bizarre details that they may remember, like a particular song that was playing or a conversation, but they don't recall the entire process or cutting or any of that process. So, and patients who are having general anesthesia have zero recollection of that entire event. So this is kind of a brief synopsis of what actually happens in a facelift. I really hope that this video has been informative, educational, you learned something from it, and it kind of reduces the amount of mystery that happens behind the closed doors. If you found this video helpful, please hit the subscribe button. It tells us that people like it and we need to continue making awesome content and putting it out there. If you have comments, you have things you've always wanted to know, hit them down in the comments below. We do look at these and we will check them out, but we'll see if there's anything that we need to answer, or maybe we may even make a future video if we get a lot of comments about a very specific question. Thank you so much for watching.